What's up, everyone? This is Dr. Charlie Johnson, physical therapist. Appreciate you checking out this channel and checking out this interview that I'll be doing today with a gentleman named David. David's actually not too far away from me. You can see the Pennsylvania map there in the corner. Also, I probably played hockey maybe with David or at least some of his friends growing up, and so we eventually found that out. But he's not too far away from me either way. Decided that he needed some help. I help people all around the world with back, butt, sciatica problems that are sort of unresolved, a little bit mysterious. Other people can't figure it out. And I helped you connect the dots and basically teach you how to use the power of your mind and movement as medicine so that you don't need to rely on other people to fix you, but you can, like David learned, actually fix yourself. All right. And so, David, I appreciate you being here, man. And it's just a pleasure to have you sort of share your story. I know that this will inspire a lot of people who are stuck. And hopefully get some insights too about how people like you might be able to get out of this trap and or this pain cycle. Cool?
Yep.
Awesome, man. So yeah, thanks for being here. And so if we can start, man, just introduce a little bit, just give people a flavor for like, what was your experience prior to joining the program? Like how long you've been in pain? Where were you experiencing pain? I know you had pain too, like not only in kind of like the butt and the legs and like, you know, stuff like that, but also like in the arms and other funky things.
Yeah.
Right. So can you kind of share like a big picture of what that looked like and how long you had been dealing with stuff?
So I had some stressful events happen in my life, and it started with left shoulder pain,
Yep.
And then it traveled down the arm into nerve pain, and then it became the right arm with nerve pain, and then within a month it became both legs.
Yep.
So I went to multiple physical therapists and would feel good for like a day. And I go back to stressing out about it. And so multiple physical therapists, I got MRIs on my back because I thought it was some type of sciatica. MRIs up here, the upper spine for the arm nerve pain. I got MRIs of the brain. Someone thought might have MS. So I was in and out of doctors for probably 4-5 months.
Yep.
And no one could figure out what was wrong. There was never a diagnosis. If there was one, it was very light, and the next doctor would say the opposite.
Yeah.
And that's what led me to you.
Yep. Yeah. So just to be clear, right, you had like, it actually started, because here's the thing. I think you actually did have a time where you kind of hurt your back around Thanksgiving, right? Or like you threw it out or you did something. Is that correct?
No, I tried to think of a way where I hope it never happened, but actually I haven't thought about this pain in months, so it's hard for me to remember all the details. But there was never a physical accident. I just remember sitting on the couch during Christmas. This is what you're thinking of. I remember sitting on the couch during Christmas, stressing out and complaining about my arm nerve pain. Then my lower back started to ache. I said, well, you know what? I've been sitting all week doing nothing. Maybe that's why my lower back hurts, and maybe that's how I pinch a nerve just from sitting still for a week, trying to let my hands heal. And sitting made it worse because I was just stressing and thinking about it.
That's right. Okay. Because I remember when I was reviewing your case, right, you had kind of presented that as sort of the injury or the mechanism of injury for kind of the back and the other stuff. But come to find out, it was sort of like this perceived injury. Like you were trying to piece the puzzle together. And so that's sort of what you came up with. But now you know it probably actually wasn't a real injury. It was just something you were grasping for straws and you happened to pull that one out.
Yes.
Right. Cool. Okay. So so I had some of this arm stuff, have some of this hand stuff, right? But like, this is the Glute Relief Accelerator program, right? Mm-hmm. And so you've got this back and this butt and this other stuff, but like, were we able to help even with the upper body stuff? Just looking forward?
Yes. I remember in our first Zoom,
I
said, here are my issues. And I remember you specialized the lower body, the back. And I said, what about my arms? Can you help me with that? And you said, oh, yeah, I think, the same answer for your legs will help your arms. I remember going to bed that night thinking, what is he talking about? And obviously it worked.
Yeah. Cool stuff. Cool, man. And so that's the reason I bring that up is that I like to teach people principles, right? If you understand the principles and the concepts, then oftentimes you can take those same things and you can apply to any situation, right? If you can learn to drive, I don't know, in one scenario, ride your bike in one scenario, then you can probably apply that same kind of those same ideas, right, of needing to balance yourself and, I don't know, do this and do that, right, like to another scenario. And so we teach you principles, kind of not like, hey, here's a sheet of exercises, right? So I just want to be clear about, you can often use the same concepts we apply if you're having other symptoms to resolve not just one area of pain or problem, but other areas as well, which is really cool. Mm-hmm. Okay, so had this arm stuff, this hand stuff, right? And then, this leg stuff. Stress around the holidays seemed to maybe be a contributor, but again, you sort of pinned it on, hey, I was sitting too long, and that's sort of the cause. And so you always went back to that structural reason as to why you hurt, correct?
Yeah.
All the doctors, they were clearly looking for a structural reason because, well, they were giving you structural explanations for why you hurt. Maybe it's this, maybe it's that. Again, no diagnosis or many diagnoses means that nobody really agrees upon what's going on. Okay. So it's not clear. They look for MS, MRIs, the cervical, the lumbar, all kinds of things. You spend a lot of time, energy, and I'm sure money, right, doing that. And so what kind of shape were you in when you came to see me? Like, were you out living your best life? Were you playing hockey? Were you running? Like, what did your activity level look like at that point?
I quit all activity. I wasn't playing hockey. I wasn't golfing. I even stopped coaching my son's ice hockey team. I figured anything I do is going to make it worse. So when I came to see you, I was doing nothing. I was a zombie inside the house, just worrying all the time.
Yep, got it, man. All right, and so you stopped all activities, right? So you were essentially trying to like rest it out and or avoid those things. What was that avoidance actually doing at the end of the day?
I was increasing the pain fear cycle.
Yeah.
Made it worse.
Yeah, it was reinforcing, right? That movement in your body equals pain, which made you more fearful or worried or concerned or whatever, attach any emotion or feeling to that, which then made you move less, which then just like hate you stuff.
Yeah.
Right? Cool. Okay, so anything else as far as restrictions on lifestyle or anything else, man, where you were just limiting yourself? So no hockey, no running, no coaching.
Yeah. No, I just wasn't doing anything physical, but I could still do my job, which is at a computer, at a desk.
Yep.
But I was probably depressed and made my wife's life miserable, being sad all the time. But no other restrictions.
Got it, man. Okay. So let's flash forward just so we can see kind of where you're at now, right? So let's start with this. How long into the program would you say you started to feel a bit better? You tried all these different things, right? And I'll probably touch base on that in a minute. But like, how long into the program did you start to notice like some change, right, in the positive direction?
I would say after the first week, just after a week, if there was like a big sense of hope, I started to feel better, but the pain was still there.
Yep.
I'd say after about a month, the pins and needles and nerve pain was gone. Got probably like 80% gone. And then maybe after 3 months, it was like all the way gone.
Yep. Cool. Okay. So in pain, I don't know, 4 or 5 months, something like that. Tried lots of different stuff. How many, by the way, like, did you see multiple PTs? Did you just see the one PT? Like, what did that look like?
I saw 3 physical therapists, 1 chiropractor, multiple neurologists, and the doctor specializes in rheumatology.
Yeah, rheumatologist. Yeah. Yep. Got it. Okay. And they basically, again, didn't really have the idea of what was going on, or they had all kinds of different ideas about what could be going on, but couldn't pinpoint it. And so you went through all this stuff, right? And then I think you found me online, right? Even though I'm local. So it's not like I've ever seen you, even though I'm probably, I don't know, 45 minutes away from you?
Yeah, I saw you on YouTube.
Yeah, that's right. Found me on YouTube. And then you decided, okay, this crazy guy with a hat, right? Maybe he knows what he's doing. And so you reached out to me. You joined the program, Glute Relief Accelerator program. And within week, you started to notice, wow, there's like definitely a shift in sort of my perspective here. Within a month, most of the nerve symptoms gone away. And then 2 to 3 months, like, where are you at now? Like, so things are gone, but are you playing hockey again? Are you running? Like, where are you at?
Well, I'm back to normal. After a month, I was back to normal, still feeling a little pain.
Yeah.
But after a month, I started doing everything I used to do.
Yep.
So right now, I don't even think about it. It's fine. I mean, every once in a while I'll feel something, but I go through the exercises and it's gone, within a day easily, but it's never at the same pain levels before because I don't worry about it.
Yep. Got it, man. That's pretty cool, dude.
Yeah.
All right. So let's talk about this, right? So I don't think you had that much resistance. Was there initial skepticism, man, as far as like, okay, can this person help? Can this person not help? Is this just going to be another PT, right? That gives me a sheet of exercises and let's hope it works.
There was no resistance, like, because my wife kind of mentioned a few times, oh, it's probably in your head. I'm like, oh no, it's not.
Yeah.
I have an open mind. I think you
Yeah.
said, you have to have an open mind to join the program. So I said, I'm going to open my mind and just try everything.
Mhm.
And I mean, all the material made sense and just clicked. So there wasn't resistance. It wasn't, I was fighting it. But I remember once I did the evidence log.
Okay, cool. So one of the tools that helped you was the evidence list inside the program, right? Which is a tool we basically give people in the beginning to determine, hey, is this something is the pain experience that you're dealing with, right? Is this something that's driven mostly by the body and or the mind? And you went back and you filled it out, and it said 90% mind, 10% body. And so you tried to josh the numbers. You tried to go back.
Yeah. Because I just,
Change it.
my entire life I played hockey. So it's like, oh, I got hit. There's an injury. And then I got to think about, wait, like, I never got hit. Nothing ever happened.
Yeah.
I tried to look for something and there was nothing to find. I go back and change the log. It's not like anyone was looking at it. It was just my log and it's for my health. So I was arguing with myself.
Yeah, so you had this internal struggle, which I always think is really fascinating, right? Because I see it happen all the time. And I actually called someone out recently on it. I said, like, you do realize that you said this, but then you answered this like this. And they're like, oh, well. And I'm like, no.
Yeah.
You're trying to skew the results. And I think that's really powerful, some of the resources that we give there, just because if you're in your mind and you're trying to like, oh, well, it could have been this or maybe this, right? Like you'll just overthink it all the time. But if you can actually put it on paper and you can be very objective about the experience that you're having, at some point, you can't really argue with it. I mean, you can as you tried, but at some point it's just so convincing and clear that it's like, wow, it's either this or it's this, right? Cool. All right. So now if I can ask you this, man, a lot of people are probably watching and saying like, okay, well, like, what did he do? Meaning like, was this just like helter skelter, just like, hey, try a bunch of random things and see what happens? Or was there a process? Now, you and I both know there's a process. But other people watching might not know that there's a process. So like, if you can share a little bit about like, what were some of those steps that you went through? So you come into the program, right? And do you just start right away with doing a bunch of exercises? Do you do the press ups like you were told to do before?
So
Or is it a little different?
yeah, I remember the first week it was just, what was the term? Stop poking the bear, calm muddy waters, and just stop doing whatever you're doing and try and relax for a week to reset everything.
Yep.
And then I remember the process started with testing exercises, the movement to see what causes pain. And I remember that's when it kind of started to click, like all these movements are so inconsistent when they cause pain. Some days they hurt, sometimes they don't. That's when I started realizing, I mean, some days this one doesn't hurt. And then one physical therapist said, do the, what's it called? Push up cobra pose.
Press up. Yeah.
Yeah. Some days it hurt, some days it wouldn't. I started realizing, man, there can't be anything structural here if it's so inconsistent.
Yeah, and I remember you too, actually. This was a little bit of a debate in the beginning, and I remember having this with you because I knew you were going to get there, right? But I just have the debate all the time. Hey, I'm doing the press-ups, and it makes my feet do weird tingles. What are your thoughts on that, Charlie? That can't be. And I'm like, hold on, man. You're looking at one isolated variable. We need to look at the big picture. So we were able to coach you through.
Yeah, I remember I kind of, when I first started feeling better, I was a little frustrated. Like, why don't you just tell me at the beginning, cut out all this weeks of me figuring out? But I think me figuring out, going through the process is what me helped to truly understand.
You know, I've tried things in different ways as somebody who coaches people through this, right? I've tried just being very firm with people, and sometimes I am if they need it, right? Like, hey, man, I'm just telling you, it's not what you think it is, right? It takes there's a little bit of an art to that, because I've had people hang up on me, curse at me, do different things like that, right? When you kind of, reveal to them like, hey, I'm telling you, this is what it is. I know you don't agree with me. There's a little bit of like I don't know, a rustle there, right? A rustle? I don't even know. You know what I mean? Okay. A tizzy, a fight, right? They drop the gloves. But either way, at the end of the day, I found that people like you are very used to going to someone, having them tell you what to do, and you just trusting the expert. And guess where it gets lots of people? Nowhere. Why? Because lots of people think that healing can come from outside of them. They just go somewhere, they get this test, they do this exercise, this person is going to fix me or whatever. Here's the thing. We're close, we've met like this, but I've chatted with you a few times, right, over the course of those few months. And I never touched you. I didn't fix you at all. Okay. And so I found that the results are much longer lasting when I let people go through the process. I can see it happening. And so I highlight that obviously when I'm coaching. Like, you're the bowling ball, I'm the bumpers, and I'm saying, hey man, you might want to like look out for this. Doop. Right. And so I obviously want to help deflect you and coach you along the process. But if I don't allow people to sometimes come to their own conclusions, then I feel like I'm doing a disservice, because that just means that then they're relying upon me telling them everything. And kind of like a child who's trying to learn to play hockey or skate or whatever. It's like, if you hold their hand for forever and you don't allow them to fall, then they will not be able to get back up and figure out how to do it on their own.
Yeah.
Right. And so that's kind of my way in this world, right, to help people, is to be a coach rather than somebody who just fixes people. I want to give you everything you need, and everything you need is there. You might be aware of, oh, okay, at this point, I need this. Okay, and that makes sense. But this isn't making sense yet. David, it's going to make sense. Okay, but you just haven't fallen enough yet or you're not ready to accept it, or you're not at a point where, you're it's something you're receptive to. Right. And so I think that's a good point. I appreciate that.
Yep.
And so, you went through the process. You started to kind of a little bit of self-study, a little bit of a reset as far as getting clarity on what you should do, what you shouldn't do, calming muddy waters. So this way, like what variables are important or not important, and you get a clean baseline. Then we started testing motions. And this whole process has you starting to have some aha moments about like, oh my gosh, this makes sense. This doesn't make sense. And you struggling internally, and I'm watching it, right, a little bit. And then we started, obviously going through the hunting for motions process. And did you find, like, was it like, did I just give you a sheet of exercises, or like, what did that look like? Because I'm a PT, right? So like, that's what we do.
Yeah. Well, the exercises were all based on symptoms.
Yep.
And remember, you take the test to figure out which set of exercises you should do. And I could tell one is for this type of pain, one's for that type of pain.
Yep.
One's for this type of pain. I remember the fourth.
Yeah. So pain pattern number 4.
That's it. Pain pattern.
Yeah. Is what I use to, I guess, classify folks who have no pattern.
Yes.
Right. Pattern number 4 is no pattern. Yeah. Right. And so lots of people that reach out to me say, hey man, how can you help me? Because none of these motions bother me. I've been told I have everything wrong, nothing wrong. The fact that you do not have any pattern does not mean that we can't figure out what's wrong with you. In fact, no pattern is the pattern. Let me say that again. No pattern in something is the pattern. The reason it's not making sense is because it doesn't make sense because you're looking at it the wrong way. And so it's probably something else if everything you're doing is not working. Yeah, so not one doctor you went to ever mentioned the role of the brain on pain, and only looked at things structurally, versus we talk about the body, but then we also talk about the brain and we connect the two.
Yes, that was the biggest thing. I remember some physical therapists give me 10 exercises to do. And if I actually had a structural pain, your program looked like you don't need to do 10. It's only 1 or 2 exercises.
Yep.
And they're all trying to give me medicine, pills, shots, surgery. And not one doctor I went to ever mentioned that.
Yep. Mm-hmm.
And at the end of the day.
Yeah. It's powerful stuff, man. And so maybe one thing I'd like to highlight is a lot of people really want to know, like, well, what am I getting into here? Right. And so I had a guy actually call me yesterday, and he's like, so what makes your program different? Because I've already tried what you tried. He's kind of like offended. Like, you think you're going to help me? Like, like, okay.
Well, I've been to so many programs and none were like yours.
Yeah.
I mean, everyone else just quick, do these exercises, go home, do the exercises some more.
What would you say, David, is the biggest difference, right, between this program, the Glute Relief Accelerator program, and other programs you try? Because most people come to see us are weighing their options. They're saying, well, I could go down the street and use my insurance for $40 a visit. And so I'm just going to do that PT. You're just a PT, Charlie. So it's got to be the same.
Yeah. So I think the biggest difference is you taught us to self-diagnose ourselves. And it wasn't just a doctor telling me, go do this. Like, I understood what I was doing. There was a reason, there was a purpose. And it was more than just 5 minutes a week at a PT. It was like all the tools online. I was hesitant about the virtual, but at the end of the day, it was the best thing ever. Like, everything was right in front of me the entire time, and all your program and your materials. And I remember I originally found you on YouTube because you were diagnosing each issue, and that's what attracted me to you.
Yeah. So at the end of the day, again, the role of the mind and the brain on pain was what blew you away.
Blew me away.
and was completely unique in that you were like, heck, didn't even know about this stuff before, right? Do you feel as though you could have gotten the same experience, right, by going and using more of your insurance down the street?
No, no way. I drove past my parents' chiropractor that they told me I needed to go to last year. And I got the chills driving past that office the other day. That guy told me, oh, it's going to take 9 months for me to get your spine straight and everything will be healed. I tell my dad, who goes to that chiropractor still, I said, do you remind that chiropractor I was playing hockey in 3 weeks, not 9 months?
Yeah.
So.
And look, this is not to put down anyone else or whatever.
Oh, I know that was mean. My dad still goes to our chiropractor, says it's the greatest thing ever, but every time we play golf, his back's still hurting. So I don't think it's working.
You're far too logical for the rest of the world, my friend. Either way. Awesome, man. So no, I think that answers the question. Again, the reason I like to ask that is because, again, lots of people are on the fence. You know, they have obviously other options where they can use their insurance. They've unfortunately too, and this is the reason why I continue every day, man, to like work my butt off to get education out there. Even when I don't feel like it, I'm tired some days or it's the weekend or whatever, is because the narratives that people are fed when it comes to why they hurt and all the stuff that they need to do, unfortunately, is largely inaccurate. And if you want to go to a chiropractor for 18 years for the same problem, I mean, I guess you can do it, right? And be told that, you know, hey, the reason your back hurts is because you're always out of alignment and you want to have like this sort of fear factor and dependency that creates this, I've got to keep going this person for however long. Cool. That's not the business model that I believe in. And it's not just ethically what I believe in is best for people in pain. And so that's why I took the shift from treating people and fixing people. I used to teach manual therapy at University of Southern California, a really well-known, prestigious, like manual therapy-based school. Works really well in the moment, scares the heck out of people, right? When your pelvis is this, your pelvis is that, right? Fuels pain, chronic pain, which is a big freaking problem in this world, right? And if you ask me, does nothing to empower the person in pain, doesn't teach you how to fish, right? And so I no longer, you know, fix people in the sense of treating them with my hands. I think there's maybe some value in that. It feels good, right? I feel like that person felt something that I couldn't, right? Whatever. But at the end of the day, I'm not sure it gives people the tools, knowledge, and understanding they need, like you now have, to like be in control of what they're experiencing and how they need to get out of pain and how they can deal with pain when it pops up in the future. Because some pain will pop up as a human living in this world. But the difference is like, do you just have to run and get a sheet of exercises? Do you need to go to the orthopedic surgeon right away? Do you need to run down the street to the chiropractor because your back is a little sore? Or can you fix it on your own? I would say you can fix it on your own.
I've been fixing a lot of very light pain on my own past few months.
Yeah, totally. And the thing is that this spills even beyond just pain. Once you understand what pain is, right, and what your nervous system is trying to tell you, you realize that this has implications beyond pain.
Yes, managing stress and anxiety.
Stress, anxiety, worry, constant hypervigilance, fight or flight, right? Yeah. All kinds of stuff, right? And so this is how, if you understand what the brain, like the brain, the mind, all right, and the power of it, and how this all connects, both the body and the brain, not just the brain only, not just the body only, but like understanding the connection there, then this is how you can take somebody with butt pain, leg pain, arm pain, numbness, tingling, other funky symptoms going on in the body, and inside the Glute Relief Accelerator program, you can teach them to apply these concepts to resolve many other things. And so the principles are applicable to almost every form of pain in the body. And then are even applicable beyond the pain experience, just the human experience, which is and includes stress, anxiety, just living in a world kind of full of that.
Mm-hmm.
Yeah, cool. So would you recommend program?
Yes.
Yeah.
Yeah.
It was worth it?
Oh, definitely. Yeah.
Cool, dude. Cool. All right, man. Well, David, I appreciate it, dude. And again, hopefully if you're watching this, it was inspiring, right? So David, again, dealt with like 5 or so months of this started kind of upper body, but then it sort of went to lower body. It was kind of moving all over the place. Spent a ton of time, energy, and yes, some money just trying to like figure out what this was, because everyone was focused on, I always say, if the only tool you have is a hammer, everything's a nail. So focus very much like on the body, like there's got to be something here. And so like when this test doesn't find it, let's do another one. And if that doesn't find it, let's do another one. PT, McKenzie press ups, chiropractic, all this stuff. But at the end of the day, like as ironic as it sounds, right? That stuff really, maybe it was for you in your headspace, but was not necessary, my friend. And you actually fixed yourself, which I'm super proud of you doing, and you putting in the effort, because not everybody is willing to do it. So if you're watching this, you tried lots of different stuff, and or you're just confused about what's going on, seems like you either they can't find anything or they can find everything, which means they really don't know what's happening, then check out a free workshop I've created. You can actually click it above. Basically starts to outline sort of the step-by-step process that we use to help people sort of work through this, like David. And I think we'll hopefully help you get some insights, and we share some tips in there too about how you can sort of move away from all that stuff and then find the 1 or 2 things that are best for you. We take a very scientific approach. All right. So thanks so much for watching. And again, hope this is helpful. Let me know if you're inspired in the comments below.